Hello everyone. I am doing my topic on online therapy and treatments, and if they're able to result in positive effects in fighting addictions. The introduction, new age social media and introduction access have shown multitude studies of web-based programs that can be helpful for treatments, therapy, and to those who are fighting addictions and or behavioral issues. And these studies they are not limited to online self-help programs or other programs, and they allow for a counselor to be involved in the method of recovery. The topics of research I chose for this that included was suicide risk screening, cognitive behavior therapy, internet therapy, hazardous drinking, smoking, and prevention of sexual violence. Here are just some key terms I wanted to bring in. Therapy, the treatment is intended to relieve or heal disorder or addiction, condition of being addicted to a particular substance, thing, or activity. Social media, which is a real key one. Websites and applications that can enable users to create and share content for participating in social networking. Trial, a test of performance quality, stability of somebody or someone. Treatment, a session of medical care, given care to a patient for illness or injury. A therapist, person skilled in a particular kind of therapy. And coaching, which is also a key one, of giving extra private training to urge someone with instructions. Suicide risk screening was an important one I wanted to start off with first, and it brought up for some really key terms such as AFSP, which is American Foundation for Suicide Prevention. This foundation created a screening program which is working with several colleges. Students were selected in the system based on the fact that they could be identified as a risk. During the test assessments of the study, the students took part of. Trained counselors were brought in to assist and review the responses from the students. They were like little red flags. Using a web-based online screening, this program protects their private information and allows for possible treatments for the risk students and can improve outcomes, and with possible dealing with the idea of suicide. The trial for this particular study was formatted using what's called eBridge, Effectiveness and Electronic Bridge to Mental Health Services. It has risk categories such as suicide, depression, and alcohol abuse. They're just some of the very few, multitude of ones that they we're looking at. There's certain questions that are highlighted that can be red flagged as the positive that student would be a risk, such as thoughts that would be, do you be better off dead or hurting oneself. Suicide risk screening continue. It's noted that students who use eBridge were most likely to seek out additional treatment or continue treatments that started during the program, which I thought that was interesting because it brings out showing that the students were interested and wanted to see if they can seek out for additional help. And after 2 months mark, the initial screening was done. They were asked if they reached out for even more additional help resources or they continued with counseling. And they are also given personalized feedback to match their answers and outcomes on the suicide screening. And which I thought was very, very important was that they were allowed to have what was called a dialogue page, which was additional for the students and was a private messenger they can use for communication with a student and a counselor, a trained counselor, and who was able to use a way of communication with eBridge. And the students if the students showed that they were inactive for too long, the counselor actually could send them up to 3 messages to get them back involved into the program. The cognitive behavior therapy. The behavior therapy I thought was intriguing because it shows an effective treatment for psychology for social anxiety disorders, which is important, and introducing the use of therapy into an internet base has a key in reducing issues that included such things as social anxiety. The treatments from the cognitive behavior therapy show they lasted and maintained for up to at least 5 years after the treatment began, which is a very good time frame. Internet-based version of this therapy is helpful to those who suffer social anxiety, and the manner for them allows them to be more comfortable receiving treatment, but there's also room for improvement so that they may want to seek additional help that may not be internet-based. And it is noted that even though it's unsure that the study would be on a larger scale as a clinical psychiatry, it is gaining, it's working in the smaller environment right now that it's being used in. More training and experience would be needed for a therapist for deliver cognitive behavior therapy, so it could work smoothly into the treatment of their programs in a bigger scale. Despite the use of therapy on a smaller scale, like I said before, the effectiveness is quite certain, and it's gauged on the level of engagement and adherence in treatment. The specific goals that were in mind for this particular study was, one, the effectiveness of the internet-based cognitive behavior therapy compared to a therapist-guided treatment. Second was the goal to see if a patient showed any change from social anxiety. And last, seeing if there was any possible increase for therapists using what's called ICBT, which is Internet-Based Cognitive Behavior Therapy. The treatment method is online. The patient completes a screening, which is a self-report measure, and overall the treatment is about 15 weeks, though it can be changed to 12. Patients use a homework-styled concept treatment, but they also have a choice of messaging the therapist at any time, which I think is nice. There's no time frame for them to say we have a cutoff, and it allows for them to complete access online treatment even once the initial treatment time of the survey and study was complete. This one, I thought it was a very intriguing aspect to my topic, is gender as a moderator. This particular study was from a study of Singaporean students, but what was intriguing about this was using the online social media aspect, and it was gauging emotional responses from like people who kind of had more of like a slight depression of things on life. And what they did was they based it off the men and women's genders and how they responded to friends who they are close with and to strangers. And in both face-to-face and online contexts, people provided information support by offering direct assistance for tasks and emotional support by giving support feedback, which I think is actually a good idea for when it comes to like therapy and counseling. The study consists of the use of online activities that include messaging, social support, and chat rooms, which are three key things in this particular manner. Shows that men and women use internet for different reasons. Women use the internet for more social media aspect, which has been proven, as men tend to use internet for more task-oriented things. Women seek more emotional support from friends, where men will be okay with getting information from friends and strangers. Studied what was interesting is the focus on the emotional reaction and the support of one using the web-based messenger for communication. So you can apply this to a different study, and you can see the emotional reactions they get from, either a friend, a counselor, a family member, to see how they can gauge how they can emotionally react to particular things. A study showed that women's emotional levels did not change as much in comparison to the men, which I thought was a little intriguing. Online messages can be a good thing. It depends on the relationship, as I spoke before, the person has with another. The manner this can be used as another treatment to help for emotional and stressful responses, as the previous one is like social anxiety. It could help with, for the study for the suicide risks, students can maybe have in contact and they can gauge emotional responses. Internet therapy, this had a bit of a smaller bit inside the topic, but I thought it was just as important. The counseling and therapy on the internet. It was focused on what's considered as quit line telephone coaches, which if they could be trained as another kind of like a hotline for people to call to train to those that are hazardous drinking smokers. The idea is to utilize a form of social media to help and treatment the addictions, and to treat the addictions that needed, they can give advice and to help and guide them. If quitline coaches could be, benefit from additional training and be able to assist those that contact them, they would be able to contact them with help with intervention. Understanding the addictions in smoking, drinking is important. The addictions in drinking is important for the quitline telephone coaches and to understand, so they can have extensive knowledge to help with treatment counseling, and can be, and they can also have what's brief alcohol interventions. During the trial, coaches were able to use a mixture of counseling brought on by intervention. They also bring out a set of a 3 procedure before they finalize treatment. And I thought that was really important, because if this could be another alternative method for someone to seek out help instead of just having to go to a support group. They can have this number to call and be able to speak to someone, and this person could be able to understand not necessarily what they're going through, but understand the addictions and possibly guide them and give them the advice to seek out additional help, but this way get them on a positive note. Lastly is prevention of sexual violence. This is an online bystander intervention program for the prevention of sexual violence. To me, I think this is a very, very important one. I think it's very intriguing because that is noted that on college campuses, sexual offenses do occur, and it's not much as awareness as it should be. And in the study, they created an online program called what's considered called Take Care, and it's been created to help address the issue. With this program, it is hopeful that the sexual violence prevention programs can be formulated to an online system to help stop the issue. It does not only warn the participants, but teaches them skills that can be used to help reduce chance of any sexual crimes. Students in this program that are listed in the program can be viewed as agents, and they are given the information with the new format, this prevention program, that can help reduce any risk of violence. Using the online prevention program, it works not only to increase bystanders' awareness, but to help change potential sexual assault. If they see someone that might be in that situation, exposed sexual crimes, they have this like online app program that they could put this information in, teaches them things, be more aware. If they see something, they can also put it in to be aware to others on the campus. And it's a program, sexual violence. These things can come from addictions. These things can be part of an addiction, and I wanted to take bits and pieces of other smaller things, besides just drug and alcohol addictions, and put them together because it's not something that it's not always spoken about. And being able to use online web-based programs and and counseling and therapy, I think it's really important because they can all intertwine. You can use one for another. You can kind of incorporate it from this particular program. It can be used for drugs and addiction, kind of intervention, getting these alternative ways to kind of open up the doors as a way, another method to try to heal, as long as the person can show that they want to change, want to help and be aware, and they can do a lot more difference in that manner. And the online web-based treatments, therapies, studies, and ideas, they've been increasing, in these last few years, and they've been helpful to those, that has addictions and behavioral problems. There's a lot of, positive aspects to using online treatments, even though it can be slow-moving, like the cognitive behavior one. It's not as, popular in the medical field, but it's getting there. Be used by patients when things are being introduced. Using web-based studies and surveys have shown possibilities that that can come from using web videos and having the the private security of the messengers and emails, and support groups being able to have these private conversations in in a face-to-face on a webcam instead of in person with a therapist. In addition, with having aspects of an additional like online coaches and people to be there to guide you, and for like the quit line. Telephone coaches, definitely a lot of alternative options. And I think as much as the negativity people can have for online internet addictions, I think this could be a good way of better way for healing. And the references I used in the 6 empirical articles and 2 online ones. And thank you everybody for reviewing this, and I apologize for taking 3 extra minutes longer.